Thanks, everyone. So again, my name is Kathleen, and we're here today to talk about the power of personalization. And before I bring up my esteemed panelists, I want to spend a few minutes setting some context of why personalization is so critical and why it's so critical now in healthcare. 3 reasons. First, consumers no longer appreciate personalization. They expect personalization. And I would go one step further to say that they demand personalization. We've seen from studies in the last year and a half that consumers no longer compare their healthcare experiences to their experiences with other healthcare organizations. They now compare us to their favorite brands, and the bar is high. Who here knows how many different combinations you can get at Starbucks for beverages? Take a guess. Over 80,000 different combinations, as reported in Forbes and HuffPost. So the bar is super high when it comes to Starbucks. 2, consumers are overloaded. We're all consumers, right? We know there's social media, traditional media, 1,000 television channels. You're getting marketed to at the gas pump. Neuroscience has shown us that the only way consumers can deal with this tsunami of content coming at them all the time is to look for relevance. So for every message that's flying by, the only ones they pay attention to are the ones that have relevance for them. So if you're not personalizing to your consumers, it's just noise. 3, and most importantly, personalization works. We've seen time and time again over 1 billion consumer interactions. When we personalize correctly, it drives outcomes. And let me give you an example of that. We've done over 250,000 barrier studies. Barriers are what keep people from taking the actions we need them to take. And we use those barriers to create personalized barrier-breaking messages. And so, for instance, if Michelle needs a screening, say she needs her mammogram, and Mike needs his colonoscopy, and we tell them that, and Michelle says, but I don't have time, and Mike says, I'm worried about cost. If I say to Michelle, well, it's free, and I say to Mike, it takes 5 minutes, guess what? That's noise, because that's not what's important to them. Instead, when I say to Michelle, but it just takes 5 minutes, and Mike, hey, it's included in your benefits, I can consistently turn 30% of the people that say no, they won't take an action, into getting them to do that action. Med adherence, well visits, screenings, you name it. The personalization works. Then people ask, well, what does a personalized experience look like? My background is companies like General Mills and Gillette. I spent 20 years there before I came to healthcare about 10 years ago. And so I like to bring the best of breed from other industries to talk about the way that we can apply those methodologies in healthcare. I'm not going to spend time going through this whole slide, but 2 that I want to pick out in particular. One is Amazon. Amazon does a fantastic job of taking hundreds of thousands of choices and whittling them down into 2 or 3 or 4 things that are meaningful to you. But they don't stop there. They continue to learn and iterate. So if you don't click on something, they serve up 3 new choices the next time. We're going to hear a lot about choices from the Paradox of Choice author tomorrow, which I'm really excited about. But the other one I want to point out is Netflix. When we talk about personalization, we think a lot about personalizing on demographic attributes, but personalizing on past consumer behavior is equally powerful, right? When you think about rewards, what rewards have they already chosen? Now you want to nudge them to the ones that they have left. Netflix, right, we take it for granted that if you've watched 7 out of the 8 House of Cards, you go back in and it's not waiting there on number 8, right? We just take that for granted. In healthcare, there's so many ways that we could take advantage of this, and I want to give you an example of a missed opportunity recently of a large healthcare organization. They did a provider comment card where a small section of the population came back and said, we don't like our doctor. 2 weeks later, they sent out a one-size-fits-all message that said, hey, go see your provider and get your well visit. Think how jarring that is to the people that just told you they hated their doc. A better message would have been, hey, maybe it's time to pick a new primary. Right? These are the opportunities we want to take advantage of in health. So where are we today? Well, everyone is focused on population health and cost. But when you think about it, population health in and of itself is really a misnomer. Because to transform health, it has to start with the individual. The individual choices we make every day, taking the stairs or the elevator, eating the cheeseburger or the salad. We need to get to the heart of what's motivating and what those barriers are for each individual in order to change them. There's a lot of work being done around cohorts, right? Hypertensive, diabetic. Now, if I knew that Michelle was hypertensive and Mike was diabetic, I still wouldn't have uncovered those barriers that were keeping them from doing what they need to do. So we have to change it to the individual, right? Here's Phil. He's got different needs. He's got a different set of resources. His health status really drives him to do things. We need to find out all of the pieces of Phil that are going to help us help him motivate better behaviors. But it's dynamic, right? Phil just had a gorgeous new baby. Congrats, Phil. But health status changes, life stage changes. So we need to be able to change with that in order to continue to motivate. So as you think about moving forward and really solving this $3 trillion challenge that we call healthcare in the United States today, we have to start with the individual in treating them like an individual. And so with that, I'd like to bring up my panelists. Come on up, folks.